Hey guys, it's Dr. Hub. Let's look at the articulation of ribs. So the articulations of the ribs. So articulation of the ribs, first we look at the joints. So what do the joints include? So joints, under the joints there is a costovertebral. There is a costovertebral. We are writing it as CV. So this is nothing but the rib to the vertebral body. So costovertebral is a rib to the vertebral body. Next we look at the CT. CT is a costotransverse. Costotransverse is from the rib to the transverse process of the vertebra. Then we look at the CC. CC is nothing but the costochondral. Costochondral is nothing but the rib to the costocartilage. Next, let's look at the articulation with the vertebra. So articulations of the vertebra. So articulations of the vertebra, it includes the rib 2 to 9. So there is ribs. There is presence of ribs, that is 2 to 9. There is ribs 2 to 9. Ribs 2 to 9 is nothing but there are presence of the 3 articulations. There is presence of the 3 articulations. So under the 3 articulations, there is a presence of the head of the rib. So there is presence of head of rib. So there is presence of head of rib, and this is to the inferior costal facet. This is to the inferior costal facet. So inferior costal facet of the vertebral body. So this will be the vertebral body above. So this will be the vertebral body. Next is the head of the rib to the posterior costal facet. Next is the head. So this is the head of the rib, and this is the superior costal facet. Superior costal facet, and this is the corresponding vertebral body. This is the corresponding vertebral body. Next comes the presence of the tubercle. So there is presence of the tubercle, and this is of the rib, the tubercle of the rib, and this is to the transverse process. The transverse process of the corresponding vertebra. So then we have the rib 1. So what is the rib 1 articulations? So rib 1 has 2 articulations, that is the head of the rib. The head of the rib is to the corresponding vertebral body. Next is the tubercle. The tubercle is nothing but of the rib is the transverse process of the corresponding vertebra. The tubercle of the rib is the transverse process. The transverse process of the corresponding vertebra. Then we look at the ribs 10, 11, 12. So ribs 10, 11 and 12. So ribs 10, 11, 12, there is one articulation. So under ribs 10, 11, 12, there is one articulation, that is the 10th rib. If you are looking at the 10th rib, this 10th rib, it is with the upper border of the 10th thoracic vertebrae near its pedicel. So it is the upper border. It is the upper border of the 10th thoracic vertebrae. Writing it as TV, and this is near the pedicel. Next is we look at the 11th and the 12th. So 11th and the 12th ribs, if you see, this is nothing but the head of the rib to the corresponding vertebral body. So it's a head of rib to the corresponding vertebral body. Then we move on to the articulations with the sternum. So how is the articulations with the sternum? So in terms of the articulation of the sternum, there is ribs 1 to 7. So ribs 1 to 7 is nothing but the true ribs. So ribs 1 to 7 is nothing but the true ribs. So true ribs is nothing but the articulate directly with a single costal cartilage. They articulate directly. So they articulate directly, and this is the single costal cartilage. The single costal cartilage. Next we have the ribs, and this is going to be ribs 8 to 10. So ribs 8 to 10 are nothing but the false ribs. So 8 to 10 are nothing but they are known as a false ribs. And how do they articulate? They articulate with the common costal cartilage. So they articulate, and this is the common costal cartilage, that is the C, C and C. Next we move on to the ribs, that is the 11 and 12. So ribs 11 and 12 are nothing but the floating ribs. So floating ribs, they do not articulate with the sternum. So they don't articulate. They don't articulate with the sternum. Okay.